Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, May the 3rd, 2021. Joining us today is Toronto Mayor John Tory, Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg, and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory?
Well, good afternoon and thank you, Brad. More than 1,204,543 doses of COVID-19 vaccine have now been administered by Team Toronto, which includes our hospital and healthcare partners, city staff, Toronto Public Health and community agencies. That's 100,000 more doses than our last media update on Wednesday. More than 40% of our residents in the City of Toronto who are eligible have now had at least their first shot, ahead of the May 5th date originally set by Premier Ford to reach that target province-wide. His setting that goal helped inspire us to get it done, and we will now look forward to setting a new target for May, though as you hear, we are not waiting to get on with the job. Starting this morning, residents 18 and older in 2021 living in 53 provincial hotspot postal codes across Toronto are eligible for vaccination at our city-run vaccination clinics. 40,144 people booked their vaccine appointment between 8 a.m. and 1 p.m. today. And as of this Thursday, all people age 50 and older, individuals with high-risk health conditions, and essential workers unable to work from home who are listed in the province's Group 1 will also be able to book appointments for city-run clinic first dose administration. The province has laid out a number of dates over the coming month on which certain groups and individuals will become eligible to receive a vaccination. This will give those groups and individuals greater predictability around the vaccination schedule. This is a good thing. It's possible thanks to increased and more predictable vaccine shipments now arriving, and we all look forward to the day in the coming weeks when everyone 18 plus across our city will be eligible for their first vaccine dose. These dates, of course, are dates on which different groups will be able to book appointments, which will take place subsequently, utilizing increased capacity we have in place through Team Toronto channels. Our Team Toronto sprint strategy is now in week 3, and we know it is making a real positive difference when it comes to vaccination rates in the 13 hottest hotspots. We know from public health data we received today that we have closed the vaccination gap between those 13 hotspots and the rest of the city. In the M1G and M1J postal codes in Scarborough, for example, we are seeing the vaccination rate has gone from below 15% at the start of April to almost 45% by the end of April. That is real progress that will make a real difference, and it will save lives. It will help to stop the spread of COVID-19, and we could not have done it without the solid partnership between the City, Toronto Public Health, our hospital partners, and the community health agencies and trusted ambassadors who have helped bring people by the thousands to get vaccinated. Public Health are adding 4 additional hotspots to our sprint strategy today, including M1B in Malvern, M1M in Scarborough Village, M1P in Dorset Park, and M1L in Oak Ridge. And, as you would expect, almost 100,000 additional doses of COVID-19 vaccine will be going to the hottest hotspots this week alone for pop-up and mobile clinics. We know from our public health officials that these doses will make a difference in our fight against the virus. These are shots in the right arms, in the right neighborhoods, in order to meaningfully stop the spread of COVID-19. I continue to urge all of our residents across the city to get registered and to get vaccinated as soon as they are eligible. We know more and more vaccine doses are on the way so that there will be more and more chances to get vaccinated in the coming weeks. We are moving out of the vaccine valley that we were in for a while due to uncertain supply, and thanks to some local and provincial decisions based on public health advice, we are moving into a period of much more robust vaccine supply to a city which needs it to combat a very significant and dangerous third wave. Indeed, supply issues were always our main constraining factor when it came to the capacity we had to deliver vaccinations in the City of Toronto. When we designed our clinic network under the leadership of Chief Pegg before there was even an approved vaccine, it was designed and subsequently equipped and resourced to do thousands more vaccinations a week than has been the case lately due to short supply. Now, we are putting that capacity to work on all fronts, and I want to thank everyone on Team Toronto for building a network from day one that always had the capacity which is needed now more than ever. We are genuinely appreciative of the extra allocation of vaccines made available by the province for implementation in COVID hotspots, and as you heard, we intend to put those vaccines to work immediately. As discussed by the GTA mayors and chairs today, it must be clearly understood that notwithstanding the considerable additional capacity that we have, still more vaccines will be required in hotspot areas. If we are to completely, on a timely basis, meet the demand created by the change to broader immediate eligibility, we will need more supply in order to meet that demand. Now I'd like to invite Chief Pegg to provide a further update on the vaccination registration underway today.
Thank you, Mayor Tory, and good afternoon. Before I begin my formal remarks this afternoon, I'd like to acknowledge that this is Emergency Preparedness Week in Canada. Never before has the role of emergency management been more evident than in response to COVID-19. Toronto's Emergency Operations Centre has been activated now for 419 consecutive days in response to the COVID-19 pandemic. I would like to acknowledge and thank each of our emergency management professionals who work each day to ensure that we are always ready to respond to emergencies as they happen. The eligibility for booking vaccine appointments is determined by the Province of Ontario. Effective 8 a.m. this morning, the Province of Ontario extended vaccine eligibility to those 18 years of age and older who live in hotspot areas. Accordingly, as of this morning, the following groups of people are eligible to book their appointments to be vaccinated against COVID-19 in a city-operated clinic. Anyone 50 years of age and older. Anyone 18 years of age and older who lives in a hotspot neighborhood. Anyone with a highest risk or high-risk health condition as determined by the Province of Ontario. Anyone who is pregnant. Child care workers in licensed child care settings. Any elementary or secondary education workers who live or work in a COVID-19 hotspot in Toronto, and any elementary or secondary education workers who support students with special education needs. Over the course of this week, we are able to vaccinate 80,214 people across our network of 9 city-operated clinics. Between 8 a.m. this morning and 1 o'clock this afternoon, 40,144 people have successfully booked their first dose and second dose vaccine appointments in city-operated clinics. As of 1 o'clock this afternoon, there were approximately 3,900 appointments remaining for this week, with the majority of which being in the Scarborough Town Centre location. Again, as of 1 o'clock this afternoon, 25,000 appointments remain available for the week of May 10th, and approximately 50,000 appointments available for the weeks of May 17, May 24, and May 31. Again this morning, an additional 20,000 appointments were made available for the week of May 10th, increasing our city-operated clinic capacity to 75,222 doses for that week. Further, the Province of Ontario has opened the next block of appointments in city-operated clinics within the provincial booking system. This new block of appointments runs from May 17 through June 6, with 180,306 appointments available for booking over that 3-week period. In total, between May 3rd and June 6th, there are 332,502 first dose vaccine appointments available in our city-operated clinics. The number of appointments that are made available corresponds directly with the number of doses of vaccine that are available to be administered. As additional vaccine is provided to the city by the Province of Ontario, we are both able and ready to expand our clinic operations to match. As a reminder, anyone who has booked their first dose vaccine appointment in a city-operated clinic will also have booked their second dose appointment as well. Our vaccine allocation and clinic operations planning includes each of the second dose requirements and scheduling as well. Finally, I remind everyone that in Toronto, we allocate any unused doses of vaccine resulting from cancelled or missed appointments in city-operated vaccine clinics directly to our hospital and Ontario Health Team partners. The provincial booking system does not include standby or waitlist functionality. These reallocated doses are administered in priority hotspot neighborhoods on a daily basis. For this reason, there isn't a standby or waitlist system required nor available within the City of Toronto. Thank you for all you do to help stop the spread of COVID-19 in our city, and please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on vaccination in Toronto. I will now invite Dr. de Villa to provide her update.
Thank you, Chief Pegg, and good afternoon. As announced last week, we've altered our reporting over the weekends, so the figure for new cases I'm reporting today is cumulative for the past 3 days. The daily average across those 3 days is 1,037 cases. The cumulative total for the 3-day period is 3,111. As of today, 1,142 people are in the hospital. 272 people are in the ICU. And I'm saddened to report 31 deaths during the past 3 days. We are on the verge of a significant expansion of vaccine access in Toronto. The mobile sprint strategy, which the Mayor referred to, is making an important difference, and the pop-up clinic campaigns were vital to it. Nothing matters more than people coming out for vaccination. So thank you to everyone who took the personal responsibility and rightly trusted the science to get out there and get a shot at a pop-up clinic or any clinic for that matter. And thank you to everyone who got those shots into people's arms. Our hospital and Ontario Health Team partners, the vaccinators who put those needles into arms, and the community leadership who are so effectively reaching into their communities. Together, you inspired and rallied the confidence in people to roll up their sleeves and take steps to get vaccinated, to protect themselves, protect their communities, and by extension, to help protect the whole city. We know that first doses go a long way to raising initial defenses in your body against COVID-19. While we enjoy the good fortune of having these vaccines available, we can't take them for granted. And I have to raise a caution today, now that we've crossed the 40% mark, and as access to booking expands. It's this, an important thing to remember. The first dose is not full protection. The vaccines work by providing instructions to your body to produce an immune response. This includes making antibodies so that your body is prepared and ready to identify the threat and overcome it. Your cells form a memory of how to do this. The second dose is a vital boost to what the body learned from the first dose. It reminds the cells what they learned, and they mount a response again. From that point, you are better ready to fight COVID-19 if the virus tries to infect you. There is emerging concern in the United States that people are opting to avoid their second dose, so confident are they in the protection of their first dose. It's important not to take the protective power of the vaccines for granted, especially soon after the first vaccination. We see this in some COVID cases, where a person with one vaccination nonetheless becomes infected. It isn't common, but it isn't impossible. Completing the 2-dose regimen helps the body learn and strengthens its ability to subdue COVID-19. We continue to learn more about the vaccines as more and more are delivered all around the world. For example, we are learning how long the vaccines provide protection. We're starting to see evidence that in addition to preventing serious illness, the vaccines can prevent transmission from one infected person to another. And there is more and more evidence that asymptomatic transmission is prevented with the vaccine. The benefits of a mix and match approach to the vaccination is under active study to determine the benefits. Medicine is confident that mixing one vaccine for the first dose and a different vaccine for the second dose isn't going to harm you. We are, however, learning what the benefits of such an approach might be. The vaccines will lead us out of the pandemic, but they are not an instant solution. We can look at places like the United Kingdom and rightly expect in the near future to enjoy the same kind of progress that they're making. But in the meantime, while COVID-19 rates remain very high in Toronto, it remains important to limit your contact with other people you don't live with, to be outside with them, not inside, if you have to connect with them, and to wear your mask, especially when you can't keep 6 feet apart. Good distance and good ventilation and wearing a mask are what you need to know most right now, whether you're newly vaccinated or waiting for your turn. With that, I'll now hand it over to Brad to moderate the questions.
Thank you, Dr. de Villa. And we'll now go to questions. Just a reminder to please unmute yourself so we can hear your question. And first, we'll go to Mark McAllister from City News. Go ahead, Mark.
Thank you, Brad. I'll leave it to my colleagues to ask questions about the vaccine rollout at this point. I'd like to start, Dr. de Villa, with the government authorized quarantine hotel near Pearson Airport. We now know that multiple employees at this hotel have tested positive for COVID-19. Just wondering how much more you can tell us about how many cases there are, the positions these people hold, how much contact they would have had with other staff and guests. Lots of questions surrounding this, obviously. And what has contact tracing told you about where they may have contracted the virus?
So Mark, thanks for the question, and I can appreciate the interest around this. Certainly the team at Toronto Public Health is aware of cases and individuals linked to this workplace, and I can tell you that staff have been assigned to initiate an investigation there. As we do in all these cases, we're working with the facility to identify those who are impacted, to review and advise on all the appropriate infection prevention and control measures, and certainly to review and advise on what is needed further to protect public health in these circumstances. As you know, we have to very carefully balance information that's released to the public with the individual's right to privacy. So we'll continue to conduct our investigation and take all the necessary actions to control risk and to ensure that public health is appropriately maintained.
Thank you. I appreciate the need to respect people's privacy. However, this is a very busy hotel near the airport, happens to be one of the quarantine hotels that the government has sanctioned, and it's operating as usual today. There are people coming and going through the front doors. There doesn't seem to be any precautions being taken at this point. What types of direction has Toronto Public Health given to this hotel specifically? What kind of precautions have been taken? And a secondary question for Mayor Tory, if I can, what does this say about the effectiveness of these hotels, in your opinion? This was put in place by government to protect people, and seemingly there are cases in the hotel itself.
So, Mark, I think it would be rather inappropriate for me to comment further while an investigation is underway, and I can assure you that Toronto Public Health staff are indeed, undertaking a necessary investigation as they would in all of these circumstances. I have complete confidence that they are following appropriate guidelines, using the best available evidence to mitigate any public health risk, and are managing cases and contacts in accordance with all the protocols that are out there. These are protocols that not only we use at Toronto Public Health, but are in fact in keeping with the science and the protocols that are put out by the province on how to manage COVID-19 cases and clusters in this type of circumstance. So I can only reassure you and the rest of the public that the appropriate steps are being taken, and that should there be any further public notification that's required, that we will do so in accordance with our current practice and in keeping with what is appropriate, while at the same time protecting the confidentiality and the privacy of the individuals involved.
Mark, I will just add the following. Throughout the pandemic, I have sat beside, as a teammate to Dr. de Villa in the making of these decisions with respect to what we see as obviously the first and foremost need we all have to protect public health, but also to maintain public trust and confidence. And every time, without exception, based on the evidence that's available and proper investigations done in a timely fashion, decisions have been taken to yes, protect public health, but also to maintain public confidence and trust. And I'm sure that in this case, given the sensitive nature of this place, that will be done again.
Thank you. We'll go next to Jennifer Pagliaro from the Toronto Star. Go ahead, Jen.
Hey, good afternoon, everyone. I wanted to ask Dr. de Villa and Mayor Tory and maybe Chief Pegg as well, depending on how these conversations are playing out. What's been discussed with provincial counterparts about lowering the age beyond 18 plus? Obviously heartened to see, as I'm sure you are, the number of people signing up this morning in hotspots. But of course, there's going to be a lot of concerns for students going back to school in the fall, and knowing that the vaccines have been approved for that younger subset, those kids that are 16 to 18, if there's any movement on allowing them to sign up.
So why don't I start with that, Jen? First and foremost, only one particular vaccine that we have currently licensed for use in the country is eligible for use to those as young as 16. I am aware of the fact that there are studies that are ongoing, and I understand that there's an application that's already been put in place in keeping with those studies around reducing the age and perhaps expanding the eligibility to a younger population. I look forward to hearing more about that. That's something that falls under the federal purview. I can also say this. My understanding is that there is a table that is actively discussing the use of vaccines in a younger population, and that's occurring at the provincial level. We, of course, here at the local level administer vaccines that are provided to us by the provincial government, and we are working, as always, in keeping with the best available guidance, and specifically the guidance on how best to use vaccines so that they're able to provide that protective benefit to the broadest range of people in our population. But it has to be in keeping with the way in which those products are licensed and the way in which they're recommended for use by the National Advisory Committee on Immunization.
I will only add to that in my own case, in terms of anything we might do to either advocate for or support such administration of vaccines to kids, I will be guided by the advice of the public health officials, starting with our own medical officer of health, but also, of course, including, I'm sure, the national medical officer of health and the provincial medical officer of health, both of whom I'm sure will be included in that as well. But I will abide by and be supportive of whatever they decide is best for these kids.
Okay, great. I think that answers my question. Thank you. And just to follow up, Dr. de Villa, on Mark's question, I appreciate that your team isn't able to give us any specific details, given that you're investigating individual health cases. But can you give us some idea of the scale of the outbreak? Are we talking 2 cases, 5 cases, 10 cases? I just think people maybe deserve to know what's happening at the hotel.
Sure, Jennifer. I haven't had the opportunity to debrief with the team yet to get all the details. I know that there is an investigation that's underway, and I'll certainly look forward to hearing from the team about their investigation and what they're proposing as next steps, which I'm sure will be in keeping with the best available evidence.
Thank you. We'll go next to John Chidley-Hill from the Canadian Press. Go ahead, John.
Good afternoon, everyone. My first question is for Dr. de Villa. Sticking with the topic of the hotel, the Crown Plaza, I'm curious if the outbreak grows in size over the next week there, would it be subject to the Section 22 closure, either a partial or full closure? And if so, what would that look like in terms of the hotel guests? Would they have to be moved, or it seems like it'd be more complicated than a regular closure?
So thanks, John, for that question. Again, I would suggest that we let the investigation take place, understand the circumstances, and make decisions around what steps are required in keeping with the assessment and the investigation and in keeping with the best available evidence. Certainly, as a workplace, there is the opportunity and certainly the applicability, I guess I should say, of that Section 22 order. Whether it's required or not will depend on the findings of the investigation, which I'll look forward to hearing about and discussing with my team when I have that opportunity.
Thanks. My second question is for Chief Pegg. Chief, obviously your focus has been on the vaccine rollout, and today, obviously it expanded. But there was a lot of talk online about how there was long lineups to get an appointment, both in Toronto and in Ontario. And also, of course, we've seen long lineups outdoor, like long physical lineups outdoors. Are you concerned at all about those long lineups and how it might affect vaccine take-up?
Hi, good afternoon, John. So I'll say first and foremost, I'm really pleased to see that since 8 o'clock this morning, when the province expanded the eligibility for vaccine, more than 40,000 people have been able to book their first and second dose appointments in city-operated clinics. I managed to just have a quick look, and since 1 o'clock, so in about the last hour and 20 minutes or so, there's been another 14,000 people booked. So that's great news. All in all, I think it's important to note that there is a significant demand for vaccine, and that's fantastic. I'm really encouraged to see as many people being interested in and pursuing their opportunity to book their vaccine appointment. That's precisely what we want to see. We are, as you know, clients of the provincial booking system, and that is what it sounds like. That is a booking system that is booking in clinics, obviously across our 9 city-operated clinics in Toronto, but also in a plethora of clinics across the province of Ontario. So there are significant demands happening provincially, but I'll go back to where I started. The fact that we've now seen 40,000 plus people booked this morning is great news. I'm excited to watch that continue today and over the next number of days. And obviously, as Mayor Tory commented in his remarks, and as I did, the moment that additional vaccines are available and can be made available to us, we are certainly ready, as we demonstrated this morning, ready to very quickly expand the operation and the capacity of our clinics to match that demand. So we look forward to that happening.
Thank you. We'll go next to Brian Passafume from the Toronto Sun. Go ahead, Brian.
Yeah, good afternoon, everybody. My first question is for Dr. de Villa. Just going back to the vaccine hotel situation. I think we all understand the need for privacy, but none of us here are asking you to name names or anything. Are you able to tell us, is it just one hotel currently undergoing an outbreak? Is there any idea of how many people are infected or what plans are in place to ensure that more don't? And as a response to Mark, Mayor Tory mentioned the need for transparency, which is great. But isn't this the same situation a few weeks ago when the city initially refused to name businesses they've closed down due to workplace outbreaks?
Brian, I think I've tried to make it very clear through the answers that there is an investigation that's underway and that there's an important assessment that needs to be done and undertaken by the investigators. Once they've actually undertaken their investigation and I've had the opportunity to connect with them, I think there'll be a greater opportunity to have conversation with the public and explain what the investigation is revealing, again, in keeping with protection of privacy and confidentiality. As I mentioned in one of my earlier answers as well, if there is a need to, move to a Section 22 order or, an outbreak is formally declared and we get to that point, we have accountability and reporting mechanisms in place that would, of course, apply in this situation. So we are certainly committed to that public accountability and transparency, but at this point in time, there is still an investigation that's underway. I'd like to let that investigation unfold. Make sure that the proper assessments are actually done, and in keeping with privacy and confidentiality being protected as best as possible for those individuals involved, I will then be in a better position to describe what's happening and to ensure that transparency and accountability are appropriately covered.
Okay. Yes, that's an answer. My second question is also to you, Dr. de Villa. You mentioned before about mixing vaccine doses. Is this something that the city is considering for people's second doses when that time comes around?
So, Brian, at this point in time, there isn't a specific plan to do that. I will just say that this is a question that many have asked all over the world, and so these studies are actually occurring and are of interest to public health authorities and officials the world over. That vaccines are clearly very, very much in demand. And I think that it behooves us to be prepared and to ask these questions and to keep apprised as to what studies are happening so that should we find ourselves in that situation, we're at least informed around what the options are on vaccines and second doses.
Thank you. We'll go next to Natalie Johnson from CTV News. Natalie, go ahead, please.
Hi, everyone. I'm curious with the influx of vaccine doses and a significant increase in the number of people who will be getting vaccinated at the city's mega sites. Can you speak to the logistics of how you'll ensure that so many people can move efficiently through the clinics without it resulting in long lines and wait times?
Good afternoon, Natalie. So the design of all 9 of our city-operated clinics from the outset has been to fully consider and fully protect against things like excessive lines. So we've designed our clinics to be efficient, and it's a concept that we refer to as the pacing of a clinic. We pace each clinic such that people, when they arrive at their scheduled time, are able to move through arrival into screening and check-in and registration, then from there into the component of the process where they actually receive their vaccination, from there to aftercare, from aftercare to checkout, and then that completes the process. Across our network of clinics, that generally takes, on average, around 30 minutes from the time they arrive and check in until the time they've checked out and are able to leave. As you recall, we have, throughout the process, we have made adjustments to our clinic operating model, and we continue to work very, very diligently across all 9 clinics, making sure that we prioritize efficiency, that we maximize our availability and our opportunity to administer vaccine, but also that we protect what we have referred to in the past as client experience. So we are still operating our clinics at significantly less overall rate than we know we are capable of delivering. I'll say that a different way. We can deliver more vaccines in each clinic each day than we are today, and that is simply because we don't have the vaccine. So I am fully confident that the present operations will continue to run smoothly, that our clients will continue to have a positive experience, and we are fully prepared with the plans in place to continue to expand as vaccine availability permits.
And can you speak to the staffing increases that you'll be looking at once your appointment numbers ramp up?
Sure. So we've actually, Mayor Tory made comments in his remarks. When we designed our 9 clinic network and operated it, we actually pre-staffed. So we have the requisite staffing in place right now It's somewhat of a dynamic deployment model in that we are able to move people and move positions both within positions in a clinic and between the clinics to meet demand. But the number of staff that we require in order to operate our clinics at maximum planned capacity, which we are not yet at, is already in place. It would simply be a matter of receiving confirmation from the province that additional vaccine is available, and then we would put the provisions in place without any delay to make that happen. So I don't anticipate any delays in those things happening. And I'll say again, if best news to me would be if Dr. de Villa phoned me or the province phoned and said that there is additional vaccine available, we would immediately be able to pivot and increase our clinic capacity and move forward.
You know, Natalie, I think there is a good news story in all of this, which is that we did, from day one, build these clinics with a very significant capacity, notwithstanding the fact that even in the early days of vaccination, there were supply issues, and of course, they've continued to one extent or another up until now. And I will say that all of the GTHA mayors and chairs today acknowledge the fact that while we're grateful for the increased supply that allows for more of that capacity to be used, that as you increase the demand by having people 18 plus, for example, able to sign up in many places today, there's going to be even more supply needed. So the one thing that in the case of Toronto, in any event, is a factor that is going to potentially and hopefully not limit our capacity to deliver is going to be supply more so than our ability in the clinics we've had from day one with considerable capacity so that we could get this done as quickly as possible and as quickly as supply permitted. But we need more supply to be committed soon in order to take account of the demand that has now been created by increasing eligibility, which happened again today. That's a good thing.
Thank you, Mayor. We'll go next to David Ryder from the Toronto Star. Go ahead, Dave.
Hi, sorry about the delay there. My first question is for Dr. de Villa. Doctor, in a report that you have that's going to the Public Health Board next week, you say that without strengthened public health measures, data analysis and projections indicate it will take until late summer before a significant reduction in new case counts is observed in Toronto. I'm just wondering what you're seeing, because we have seen, understanding is very fragile, that there has been a fairly steady drop in cases since the middle of last month. What are you seeing that would suggest that would not continue, and what does that mean about what we have to do to prepare for that?
So David, that's in reference to what modeling shows is likely to happen in terms of the daily new cases of COVID-19 if in fact public health measures are not continued and the self-protection measures that we've been advising people to follow are not well followed. This is premised again on modeling data that we have. These are the kinds of data that we're using to help inform the best course of action over the course of the pandemic. So what the report refers to is the need to be vigilant in respect of practicing good public health measures, the need to ensure that vaccines are being taken up by a large proportion of the population, and the need for people to continue to be cautious, particularly around self-protective behaviors, because we know how COVID-19 spreads from one person to the next. If we want to continue to see the decline and the decay in the number of cases sooner rather than later, it's the combination of these things that is going to need to be practiced diligently and effectively by all of us.
Thank you. And follow-up is on vaccine rollout for Chief Pegg or whoever wants to answer. And that's Chief Pegg. In a recent, I think it was the week before last, you talked about with increasing supply, we'll aim more of Toronto's share at the hospital and health partners that can do mobile and pop-ups. I know that recently not all 13 of the hottest of the hotspots had those clinics. Does anybody know if those 13 are all now covered with at least one of those kinds of clinics where anybody can show up? And is there plans, or can you tell me how many more of the hotspots are on the list for those kinds of clinics? Thank you.
Sure, I'll start, David, and then perhaps Dr. de Villa can speak to the second part of the question. There is an allocation of a considerable allocation of vaccine that is being provided to our hospital and Ontario Health Team partners. In fact, I have the data for this week. This week's allocation, approximately 27% of the total weekly allocation for the City of Toronto en masse is allocated to the city-operated clinics. The remaining 73% has been allocated to hospitals and Ontario Health Team Partners for administration in those hotspots. So those are decisions that are made medically, based on medical science. And then, of course, the allocation that is provided for distribution and administration in the city-operated clinics is the primary, my primary focus and the primary focus of our team with respect to our clinic operations. Dr. de Villa can speak further.
Sure. Thanks, Chief Pegg. So with respect to the hotspot strategy and the sprint strategy that you were asking about, David, for now, we are continuing as the Toronto Vaccination Partners to continue to focus on those 13 postal code, hotspot postal code areas in the city, and to expand a little bit more to areas in Scarborough, some other postal code areas that the Mayor described in his remarks today in Scarborough. The pop-up clinics, the mobile clinics that are being operated by our vaccination partners are moving around those communities and getting at those neighborhoods and areas of those hotspot postal codes that were not covered previously, but certainly we are very, very pleased, I think, as vaccination partners, and certainly in my role as a medical officer, to see the uptake of vaccine has been really remarkable through those mobile and pop-up clinics. And, you know, I really can't thank the vaccine partners and our community leaders and all those engaged in those efforts enough for what they're doing and for their remarkable leadership and work.
David, just to remind, 100,000 additional doses have been allocated across the original 13 hottest of hotspots in the Sprint operation, and 4 more added in M1B Malvern, M1M Scarborough Village, M1P Dorset Park, and M1L in Oak Ridge. So those 4 postal code hotspots will be added, and the 100,000 additional doses will be spread across the 13 plus 4 to get on with the job of making sure as many vaccinations as possible are delivered in those hotspots.
Thank you. Final questions to Chris Glover from CBC News. Chris, go ahead, please.
Last but not least, thanks guys for taking our questions. We always appreciate it. I was wondering a little bit about, as we're talking about all of these vaccines being funneled to hotspot neighborhoods in particular, the Science Advisory Table had recommended diverting 50% of the province's vaccine supply for 4 weeks for a best possible impact. Instead, the province has chosen to redirect 50% of supply to the hot zones for 2 weeks. Some of the doctors that we've been interviewing, especially today, worry that that could hamstring the efficacy, I suppose, of this move generally. Particularly, I'm curious, Dr. de Villa, what you think of this, and do you think that 2 weeks is enough, or would you have preferred 4 weeks?
Well, Chris, I think if you haven't surmised from the comments made by Chief Pegg and the Mayor, we will happily take as much vaccine as the province is willing to give us. There's no question. We have capacity. We've designed a system that is more than capable of handling more supply of vaccine, and we are just as eager and maybe even more eager than anybody else in the province to ensure that residents of the city who are getting vaccine, that we want to make sure that everyone in Toronto who wants to get vaccine is able to get vaccine as soon as possible. So obviously, I'm very committed to ensuring that we're applying the best available science. I recognize that there are supply challenges, not just here, but the world over, and we look forward to working with our provincial counterparts, you know, on how best we ensure that we are afforded that possibility of using the best science to protect our community and to help get us to the other side of this pandemic.
Brad, I will just note that the Greater Toronto and Hamilton area mayors all shared in the view today that because of the good news story of increasing the demand and eligibility for vaccinations, and notwithstanding the fact there has been an increase in supply, that more of an increase in supply will be needed. And so that was a view unanimously held by those mayors who represent millions of people in the entire region, that if we're going to do the job we have to do. So this is something that will be, I'm sure, under active discussion, but in the meantime, we're getting on with increasing the utilization of capacity we have in place in the City of Toronto to vaccinate more people commensurate with the supply that is available, but with an eye to saying that more is always needed, especially in places like this where we have the capacity to deliver it.
Okay, and my follow-up, I think, would be mostly for Chief Pegg, though if anybody else wants to chime in, that would be fine as well. Another concern that I'm hearing is that we need to have the vaccine clinics operate on a 24/7 capacity, at least some of them, and that is due to the fact that a lot of the people in these hot zones who are essential workers work odd hours and they wouldn't necessarily be able to access a clinic during the day. So is there any sort of plans in place at this point, or do you think there should be to operate on a 24/7 capacity?
Hi, good afternoon, Chris. From the outset of our planning and from literally from the time that we launched our very first clinic, we have had robust plans in place to expand our clinic operations to match vaccine availability as it occurs. So we are operating today based on, or in response to, I should say, in response to the amount of vaccine that is being provided to us by the province. At the point where that quantity of vaccine increases in a reliable manner, we have plans in place to expand our clinic operations accordingly. So I know we sound like a bit of a broken record, but it all does really hinge on the availability of supply and the reliability of that supply. So the moment the province is in a position to provide us more vaccine, we are in a position to expand our clinic operations, and we have plans in place to expand clinic hours and operations as required as well.
All right, thank you, Chief. Thank you for joining us. That concludes today's briefing. Our next scheduled briefing will be this Wednesday, May the 5th. Please stay well.